Hello, I wanted to give an update to the BSD community today as we are ending 8 weeks of school. If you can believe it, it's been 8 weeks. The last time I gave an update was about a month ago on September 29th. So overall, I think we can say that things are working well in our hybrid model as far as managing and preventing any spread of the virus in schools. That's in large measure to the precautions that parents are taking and keeping kids home if they have any symptoms of any kind. Precautions our teachers and our faculty and staff are taking, and the good work of our school nurses in monitoring people. So we've been fortunate, but it's in large measure because people are being careful. A month ago, roughly, on September 29th, when I last reported to you, we had 13 active cases in the district across our schools and across transportation and our operations. Today I can report to you that we have 5 active cases. So that's good. We're moving in the right direction inside of school. At the same time, we know that in the community the numbers are going up. So that's the precaution, that's the caution that we have to take and that we have to worry about. We have had overall 12 hybrid students who were positive. Again, they didn't contract it in school. 11 e-classroom students and 16 employees. So we can see a spread across. I think it's important to note with the e-classroom students make up 26% of the total school district student population, but they're over 40, between 40 and 50% of all cases. So I think the message there is we have to be careful wherever we are. If we're in school with the hybrid, we need to maintain our social distancing, maintain the masking, maintain the washing of hands and the hand hygiene. And even for kids who aren't in school in e-classroom, we need to maintain those precautions as well. But my takeaways are, despite the community increase, the hybrid model is working. The things that we're looking forward to, the challenges we're looking at right now are several. One, what our public health friends call pandemic fatigue, that we get tired of wearing the mask. We get tired of social distancing. We let our guard down. That's when the virus can spread. So please, we all feel it, but fight that pandemic fatigue. Another concern that we see on the near horizon is students coming home from college. So colleges have been hotspots around our state and around the country. Students come home at Thanksgiving time, college students, there's a potential for additional spread. So we need to be cautious around the holiday times, holiday gatherings, holiday travel. These are the big warnings that I'm getting from the Bethlehem Health Bureau and from St. Luke's University Health Network experts on their concerns. And then also we're moving into the flu season. And the combination of flu and coronavirus can really put a strain on communities. So the advice that I'm passing on to you that I'm getting from our health experts there is please get the flu shot. Because then if there are 2 threats in the community at the same time to health, the flu and the coronavirus, at least we know we can inoculate ourselves against the flu. Since there is no immunization for the coronavirus. So again, at the end of 8 weeks, things are working well. We want, as we approach the end of this first quarter, we want parent feedback. We're going to be sending out a fairly detailed survey to all parents next week. We want your input on how's it going academically, how are the in-school days going, how are the online days going, what are the child care needs, how are we supporting students with IEPs and 504s. And then we're going to ask you some questions as well about if we made some tweaks, some adjustments to the way the schedule is. Get your feedback on some of the potential tweaks that we might make as well. We know that there are students who aren't engaged online, and we're concerned about them, and we're looking at ways to better engage those students, and we're going to continue with your feedback and feedback from teachers and principals to make the system, the model that we're using, better and better. Because it does look at this point, although we've made no formal decisions about length of time we'll be in the hybrid model, but with the numbers going up in the community, the reality is that we'll most likely, it's probably safe to say that we're going to be in this model through the holidays and through the end of the first semester, the third week of January, and we'll see where we're going from there. But between now and there, we want to see what adjustments we can make to improve things. All right, stay safe. Remember that a pandemic is not an individual health crisis, it's a community health crisis. Let's please treat each other with compassion and grace. Thank you.